much. Good afternoon, thank you for waiting, I'm sorry for this delay. My topic is, this afternoon, predictable dental implantology with basal implants. Now, some of you may have been reading recently an article in one of the Hungarian journals, and there was a professor, I think from Szeged, reporting very bad about basal implants, about peak implants. Now, I would expect from a professor to report facts, and I would understand if this article would have come up with facts. Like, I have been working with a conventional dental implants for the last 5 years, and I did 500 cases, and at the same time I did 500 cases with basal implants, and the results are like this and like this and like this, and for this reason I have decided for myself, and this is what I recommend to my students, I will stick to the two-stage implantology. But unfortunately, in this article there were no facts at all. It was an opinion article, and of course this is not of any help in our profession. If you are interested to read more about basal implants and about the immediate loading concept, about immediate loading in implantology, I recommend that you read, for example, this textbook, Immediate Loading, was issued by the International Implant Foundation, and in the English language we do have the second edition available now. It's also available in Russian. And for those of you who are more interested in the scientific approach to this topic, they may read the book Principles of BOI, which came out in the year 2005 in Springer Verlag, and it's in English language also. Now, for this lecture, I want to speculate a little bit about the word predictable. What is really predictable in our world? What is predictable and constant? Which things are really constant? And you will see there are not so many things constant. For those of you who are interested in reading more scientific articles, there's a website, implantdirections.info. So on this website we are publishing a quarterly journal about basal implantology and immediate loading. Now, facts and theories in normal life. This graph shows you how it should be. We have a big number of facts available, then we have something I want to call now mesofacts, something which we take as a fact, and on top of it we are finally building a theory. This is what we expect by science to do, and of course the theories then have to be proven, so we are then going back to the base, we look even deeper into the facts, and this is a normal situation, how science should work. Now the problem, I mean, I'm also 50 now, so my days of student times are long ago. Now the problem is that we cannot take everything as a fact. And if you look at this, slide, you will see in macroscopic anatomy, we have a lot of facts, and these facts remain valid over 50 and 100 years, so there are very, very little changes in the facts which are provided by the anatomy department. In physiology and biochemistry, of course, we have a different situation. These disciplines, of course, they're also working with facts, but the facts are changing rapidly. So I've placed here 3 to 5% per year in physiology, 5 to 10% in biochemistry. Then the diagnostic possibilities are enormously increasing, so we have a lot of changes in the diagnostic possibilities every year. And if we look at the treatment modalities, I mean, not only in dentistry, but I mean, in general treatment, everything, you know, the cancer and all diseases of the skin and the heart and so on. So the treatment modalities in some fields can change up to 50% every year. So we are, of course, all working in a profession which is not constant. There are some areas in the world who already have advanced, and there are some areas in the world who have not had access to new information. Maybe they don't have access to the diagnostic possibilities and so on. So what is predictability and what are facts? Please keep this in mind when you are talking about dental implantology. I want to give you an example outside of dentistry. We have all learned that there is a constant of gravity. So I think you all know this constant of gravity. Isaac Newton, this was way back in the school. Then later on, maybe in the university, we had to learn it again. And well, the reality is, the constant of gravity is not constant at all. So profound measurements have shown that there is no constant of gravity. And the reason is, of course, that this red ball does not only tend to fall on the Earth, but it has a little bit also a tendency to fall to some other moons and suns and so on. So this constant of gravity is not constant. This is a simple truth. So from this we learn knowledge changes. The rules of calculation have to change also. And we learn, because the constant of gravity, of course, is taught until today in our schools, all of our children learning about the constant of gravity, which doesn't exist, but they have to calculate it. So it cannot be sure that our teachers are mentioning this and that our teachers are noticing the changes, and even science doesn't recognize new findings. So even if we were told the truth, would we forget what we know? Would we forget what we were told before? And I think everyone in this auditorium has to ask herself or himself this question. Because the big problem in our life is not actually the learning. We are all trained to learn, but only few of us, maybe nobody, has really had a profound training in forgetting. And this profound training in forgetting is necessary when you are approaching new technologies and when you are approaching a new field like basal implantology. And the point number 7, unfortunately, the practitioners found the truth about the missing constant of gravity. It was not that Isaac Newton kind of reconsidered and said, no, there is no constant, but it was the practitioners who found it. It was people like you and me. A different example, even worse. The speed of light in vacuum is a fixed maximum measurable speed called c. C, of course, for constant. Again, almost 300,000 kilometers per second. And Mr. Albert Einstein has found this. Now, profound measurements have shown that between 1928 and 1945, the speed of light dropped by 20 kilometers per second. And after 1945, the speed of light became larger again. Now, this is, of course, pretty unfortunate because this is, in this case, not a constant anymore. It is changing. Even the speed of light is changing. So, of course, the science profession was pretty worried about this. So what they did, in 1983, the length of a meter was directly connected to the speed of light. And this way, the problem was solved for science. And the other problem, of course, is that our meter is not constant anymore. The length of a meter changes now every year. I mean, you're not noticing this because this meter which you buy at the Baumarkt is still going to be the same. But you can see from this how we are fooled and how the science tries to stay with some constancies and how they have big problems. How even we all have big problems to accept new truth and new realities. So knowledge changes, constants are sooner or later not constant anymore, and many workers in the science don't want to admit the wrong assumption. They have their own way of covering up, and in the end, the practitioners have to find out the reality. So let's move a little bit to implantology.